Hi, I'm Dr. David Green, CEO of Preferred Pain Center here in Phoenix, Arizona. Today I'm at Phoenix South Mountain Park, which is the largest city park in the country. It's over 25 square miles, over 20,000 acres of land, pristine preserve, and the city bought it back in 1924 from the U.S. government when Calvin Coolidge was in office for the grand total of $17,000. Unbelievable. They've added over the years a few more thousand acres to where today it's at 25 square miles. One of the most interesting points about Phoenix South Mountain is that there are a lot of radio towers actually behind us, very high elevation with not many obstructions, so a lot of the radio stations put the towers up there. There's also an animal very prominent here called a chuckwalla, which I've never heard of, but evidently it's very high densely populated here. The topic for today is a review of epidural steroid injections in pain management. There are 3 different types of epidural injections that pain management doctors do, and our pain doctors who are board certified and fellowship trained do all 3 of the injections. I'll start with the least common, which is called a caudal epidural steroid injection. Caudal refers to the bottommost part of the spine, sort of below the sacrum, where there's an entry point that a pain doctor can go into, and they'll numb up the area and put a needle through the caudal foramen there and inject steroid medication sort of in a blush of an injection that then travels up the epidural space and can hit multiple different nerve roots. It's a good injection for a patient who has problems at multiple levels, diagnosis at multiple areas. That epidural injection isn't going to do it. You would need multiple levels. So caudal epidurals are not very popular these days, but they do serve a valuable purpose, and they can be extremely effective for the right patient. The second one that I wanted to discuss is called an interlaminar epidural injection. This is the most common type of epidural injection performed in this country, and it's the one that's been done for the longest period of time. It's been done for over 30 years, and a lot of doctors, let's say orthopedic doctors or anesthesiologists, used to do it in their office without any sort of x-ray guidance, and some still do that. And they say, oh, it's easy, I know exactly where I'm going. They'll put the needle, they'll numb the skin up, they'll put the needle into the back, and they'll actually use where you're putting it in, and then you can sort of almost feel it give way, and then you push a little air in to see if it goes into the epidural space. That sounds, in theory, fine, but when studies were done looking at the accuracy of epidural injections interlaminar, they showed that there was over a 35% miss rate without using x-ray guidance. So think about that. You go to all this trouble to get an epidural injection to help your back pain, leg pain, whatever kind of pain that you're suffering from, and there's a 35% chance it's going to the wrong area. That's not good enough anymore. So what most pain doctors will do, and ours does this, is administers the epidural injection under a special kind of x-ray called fluoroscopy. The fluoroscopy machine is a real-time x-ray. It can show the pain doctor very accurately where the needle tip is going, and then you can put a little dye in, non-ionic dye, and you can actually show that you're in the right place. So you have the best chance of pain relief. So an interlaminar injection is the steroid goes into the area right where the nerve root is coming off of the dural sac, so they call it epidural, and the nerve root is coming off. So it can be very effective. The gold standard these days is a steroid injection, plus usually some numbing medicine like lidocaine or marcaine, and that can give you relief for days to months. The last type of epidural injection I wanted to recommend, talk about, is called a transforaminal epidural steroid injection. When the nerve root or roots come off of the dura, they get out from the spinal canal and they go out through what's called a foramen. It's a exit hole that the nerve root goes out and then it goes to do whatever it's going to do. As far as, L5 goes down to the muscles that help you lift your foot, things like that. So the foramen can get obstructed by a slip disc, a herniated disc, and you can get a lot of what's called sciatica, or another term for that is called radiculopathy. And before you have surgery for it, a course of epidural steroid injections may do the trick. So if a pain doctor can get closer to the problem area, and a lot of times a transforaminal, through the foramen injection, can get you right to the problem area, get you some pain relief with the numbing medicine and the steroid, and get right there and just bathe that nerve root in soothing, numbing medication that can then give you some relief, so that maybe that little piece of disc will disintegrate by itself and you can avoid surgery and get back to doing all the things that you need to do: work, play, socialize, do recreational activities. That's what it's all about. So those are the three types of injections. What are the results? Well, epidural injections overall have 75% good to excellent chance of success. So think about that. You go in absolutely miserable, you have a 3 out of 4 chance of success. It's very beneficial to avoid surgery and get out of the horrific pain, the burning type of sciatica that you're having. There you have it. Visit our website for much more information, preferredpaincenter.com. You can also do /blog on the end to visit the blog of pain. We have lots of animations, educational articles, and videos. Give us a call today for an appointment at 602-507-6550. We get patients in very quickly. We take a lot of insurances. I'm Dr. David Green, Preferred Pain Center. Your pain stops here.